Parca section 2.3 covers types of joints, ribs again, appendicular skeleton, upper extremities, lower extremities. Ribs are so important they felt the need to include them twice. Ribs just make me hungry for barbecue. Anyway, types of joints. Joints can be classified by the type of tissue present, which could be fibrous, cartilaginous, or synovial, or by the degree of movement permitted, synarthrosis, amphiarthrosis, or diarthrosis. So, fibrous are bones connected by fibrous tissue. Cartilaginous are bones connected by cartilage. Synovial are articulating surfaces enclosed within fluid-filled joint capsules. That's the types of tissue. And then the types of movement are synarthrosis is an immovable joint. Amphiarthrosis is a slightly movable joint. And diarthrosis is a freely movable joint. Let's go a little more into that. So a fibrous joint is where the bones are bound by a tough fibrous tissue. These are typically joints that require strength and stability over a range of movement. In a cartilaginous joint, the bones are united by fibrocartilage or hyaline cartilage, and there are two main types. A synchondrosis, primary cartilaginous, or symphysis, secondarily cartilaginous. Synchondroses. In a synchondrosis, the bones are connected by hyaline cartilage. These joints are immovable. They are synarthrodal. Symphysis. Symphysial joints are where the bones are united by a layer of fibrocartilage, and they are slightly movable, which is an amphiarthrosis. And a synovial joint is defined by the presence of a fluid-filled joint cavity contained within a fibrous capsule. They are freely movable, diarthrosis, and are the most common type of joint found in the body. And if you're like, where do all these joints occur? You can Google symphysis joints, synchondrosis joints, cartilaginous joints, fibrous joints, and it will give you a list of all the different places where you can find these types of joints. For example, the pelvis is joined by a symphysis. So that's a place where there's a symphysial joint is in your pelvis. Those joints are an example of that. So feel free to look that up if you want more information, or you can just memorize these facts and you'll be ready for the test. Ribs again, we did this in the last section, so I'm not going to talk about that because you already know all the ribs. Axial versus appendicular skeleton. Parca loves this distinction, and there's nobody that's ever passed the clinical portion said they didn't get questions about axial appendicular skeleton, which is a long roundabout way of saying they always ask questions about this classification. So your axial skeleton is made up of the bones in your head, neck, back, and chest. Your appendicular skeleton is made up of everything else, the bones that attach to your axial skeleton. So the axial skeleton is right down the middle of your body. It's the skull, facial bone, cervical spine, ribs, sternum, lumbar thoracic spine, and sacrum. The appendicular skeleton is everything that connects to the axial. It's the upper extremities, the lower extremities, the clavicle, scapula, and pelvis. Here are the bones of the upper limb, and I'm not going to read these to you. You can study the slide and learn the bones of the upper limb and then the leg. Those are the bones of the leg. You can study that. So that is Parca section 2.3, and pay particular attention to the axial and appendicular skeleton questions. Thank you for watching.